As a pediatric immunologist, I always suggest we must avoid oral polio vaccine in children with immune deficiency. Let's understand why. Recently, there was an important publication by our group in the journal Vaccines with an impact factor of 7.8, where we assessed the excretion of enterovirus and especially the vaccine derived polioviruses in patients with primary immune deficiencies. As you can see, the important center was the ICMR Center of National Institute of Virology at Mumbai, wherein the testing was carried out. Several centers across India shipped samples to this lab, and Department of Pediatrics Aster CMI Bangalore was an important collaborating center. What did we do? We collected stool samples from patients with primary immune deficiencies and shipped these samples to Mumbai, wherein in the laboratory they tested for viruses, especially the polioviruses. Now, as we all know, polioviruses have been known to cause a dreaded disease which causes paralytic polio. Thanks to the vaccinations, including oral polio vaccine and injectable polio vaccine, this disease has been essentially eradicated in most of the globe. And that is why in 2014, on 27th March, WHO declared India as free of polio. However, at present, two of our neighboring countries, Pakistan and Afghanistan, still have wild poliovirus circulating, and that is why it is very essential that we vaccinate our kids in India to prevent any future outbreak. Well, when we give oral polio vaccine, this virus multiplies in the intestine and there will be a shedding through the stools for a few weeks. This shedding will occur only for a few weeks in immunocompetent children. So, what is this vaccine derived poliovirus? One must read this important paper published way back in 2009 in the Journal of Vaccine to study the impact of vaccine derived poliovirus on eradication of poliomyelitis. Well, vaccine derived poliovirus is nothing but when you give OPV, if the virus keeps multiplying and mutating, and if the mutation result in a strain which is more than 1% divergent from the original strain, we call it vaccine derived poliovirus, and in certain people, it can turn neurovirulent. Well, why does this happen? This is because if there is ongoing shedding of this virus for several weeks to months, this virus will keep mutating, resulting in development of VDPVs. And this is possible especially if the patient is immunodeficient. So, in patients with immunodeficiencies, like with hypogammaglobulinemia and combined immune deficiencies, because of the underlying immune defect, these patients don't clear the virus. So, there will be ongoing viral replication resulting in mutations, and that may result in occurrence of VDPV. Well, what was this study about that I was talking at the beginning of my presentation? Well, this is a study wherein we assessed enterovirus, including poliovirus excretion in patients with PID. And as you can see, in this 2-year study, 154 cases were enrolled. 4 cases, in fact, were tested positive for polioviruses, and one child with hyper IgM syndrome, which is an immunodeficiency, had excretion of a poliovirus, which was 1.6% divergent from the original strain. And that is why this is said to be VDPV. So we detected a case of VDPV. Fortunately, there was no neuroparalysis. So the implications of this study, one must avoid oral polio vaccine in immunodeficiency patients and close household contacts. We can give IPV to these patients. And there is a need for prompt initiation of VDPV surveillance soon after the diagnosis of immune deficiency. And that is why we are now into the phase 2 of this study, a WHO funded study wherein several centers across India are now shipping samples to pick up VDPVs in patients with immunodeficiency. Thank you.